This is the nervous system that we can't consciously control. This is the part of the nervous system that's actually nerves coming out off of the lateral horn of our spinal cord, going to do autonomic things like telling our heart to beat, although the heart can beat on its own even if there are no nerves, but it can tell it to beat faster or slower and tell our gut to move food along. This is the part of our nervous system that we're not in conscious control of, and we are going to be doing all of the parts today. So everything is this two-step pathway. So I want to make the distinction just quickly about what I mean by the two-step pathway. We've already talked about, say, here's a brain and here's a spinal cord. And if we're going out to, say, a skeletal muscle, this is a really bad drawing of a muscle, we talked about it being the primary motor cortex going down the spinal cord. And what we have is from the spinal cord, if you guys remember the anterior horn, it's going to go straight to the muscle. So that is one step. Conscious thought, we're doing a two-step pathway. So there's an extra step within there that I want you to realize. We did the somatic, so this is what we've already done. So this is going to be our one step. That's our example, that's our reference. So this is old news, the somatic, that means our muscles, I should say skeletal muscles would be better, so our voluntary part. So what we're doing today with the autonomic, this is the topic of today, is it's without conscious instruction, and it's going to be the two-step path. What we have of our, again with the old news, this is our skeletal muscle, somatic, and this is our one step. We go straight from dendrites and axons in the anterior horn, the axon, the dendrites and cell body. The axon comes off, release. Now remember it's acetylcholine. Remember we did this neuromuscular junction. There's a skeletal muscle. So that should be what you already know. That was from Unit 2. So the top part is our new stuff. We have also cell body dendrites. They're located in the lateral horn, but you don't need to know that for now. But they're coming out the motor side. But now we're going to the axon terminal here. And so if you remember in there, we'll have little dots. That's the neurotransmitters. And then we have a second nerve. Here's dendrites, cell body, and another axon with the axon terminal with neurotransmitters. So you can see that there's one neuron here and there's a second neuron here. That is the two-step pathway. Rather than coming from the spinal cord straight to the axon terminal and you're straight to where you need to go. This one has this little connection in the brain. We talked about that being gray matter, wherever a synapse takes place. But when it's outside here, we call it a ganglion. You heard about dorsal root ganglions back here. It's a cluster of cells. That's for sensory, but that was Unit 2. So right now we have these ganglion located outside the spinal cord where the first neuron, so this number 1, it's known as the preganglionic neuron's going to be there, and then number 2 is going to be known as the postganglionic neuron. Inside, and if a question were to come up and say, what's in a ganglion? You could say, well, there's the axon terminals from the preganglionic neuron, and there's dendrites and cell body from the postganglionic neuron. It's where they're going to make a synapse. So we'll be going over this a few times. So you can see this in a little more of a schematic kind of way. We have the central nervous system. This would be spinal cord, and it comes out, and here's our ganglion. We have the axon terminal of this preganglionic neuron. We have our cell bodies and dendrites of our postganglionic neuron. And so what's actually going to release a neurotransmitter is this one here is actually going to go to the guts or to the heart or wherever, or to salivary glands. This is what's actually going to cause the effect to happen, but we have to go through 2 steps to get there. So preganglionic neuron, step 1, postganglionic neuron, step 2. Preganglionic neurons, they're starting from the central nervous system and they end at the ganglia. End at the ganglia. The post is going to actually end at, we call it the effector tissue. That just sort of means wherever you're going. It could be the heart, it could be the guts. It just means where the tissue is that you're trying to make a change to. So again, with this picture, I think I have it drawn. So preganglionic neurons, and I'm trying to put this similarity that we've already done in Unit 2 with the somatic. And this is going to be an important similarity because when we do the actual neurotransmitters, you guys should already remember acetylcholine was what was released from our axons to tell our skeletal muscles to go. Acetylcholine is being released normally onto skeletal muscle. And I have both of these in the same color because the preganglionic neuron, so the preganglionic neuron on the autonomic nervous system, I have them both in blue because I want you to realize they are both actually releasing acetylcholine. The postganglionic neuron is what's going to then go to the effector, whether it's in this case a trachea to cause constriction or smooth muscle or glands. And so sometimes it might release acetylcholine or sometimes it might release norepinephrine. It depends on which nerve. So these neurotransmitters are going to be important. We have preganglionic neuron that releases acetylcholine onto a postganglionic neuron. And the postganglionic neuron is going to release, in this case, acetylcholine. To say, well, the heart, acetylcholine is going to cause the heart to decrease, slow down. Whereas in the middle one, if we have our preganglionic neuron releasing acetylcholine, so it does the same thing, acetylcholine activates the second neuron, then it goes, and in this case, if it releases norepinephrine, if we're talking about the heart and that happens to be the tissue it's going to, it's going to actually increase the heart rate. Parasympathetic is our mellow digestion. The term for that is the feed and breed, because you actually need parasympathetic for sexual arousal too. Sympathetic is our flight or fight. So you can see in the case of sympathetic, norepinephrine is going to raise your heart rate. But it also might decrease digestion. So it doesn't mean it's going to raise everything. It's just going to do things that's going to make it easier for you to fight or flight. Okay, the bottom line here, we have this one going to release acetylcholine. So the point of all of this is anything starting from the spinal cord and coming out, whether it's to the ganglia, so it's the first one, or if it's a skeletal muscle, it's going all the way there, it will always release acetylcholine. In the autonomic nervous system, it's the second step, whether it's going to release acetylcholine again or norepinephrine is really what's going to tell our tissues of our body what it needs to do. For the autonomic nervous system, we have the parasympathetic, which is our feed and breed. Most of our time is in this state. We're facilitating digestion. We have minimal blood flow going to our muscles outside of just keeping it to survive. Versus flight or fight, we are going to shut down blood flow or reduce it significantly to our guts to allow more blood flow to go out to our periphery so we can be ready to run away. So it's actually raising heart rate. It might activate some systems, but it's also going to depress other systems. For instance, it might tell your body, hey, if there's going to be a big tiger chasing after me, maybe we can not digest so much. Let's reduce the blood flow to the guts. Guts, you can do your stuff later. We need to run away now. And so blood's going to get diverted. So again, I don't want everyone to think that sympathetic activates everything. It shuts some things down. So the effect of increased sympathetic activity, these are all things with the flight or fight. You're going to increase your metabolic rate. We're going to shut down digestion, urinary functions, unless you have pee and makes you pee your pants because you're so scared. And that's your body's way of just saying, let's lighten the load so we can run faster. But generally, you're going to slow down maybe some of the urinary processes in the kidneys and so on. And then you activate energy reserves. So you actually boost your metabolism short term with sympathetic activity because it's trying to make you go away from something dangerous. So these are just some other things that you can know about this. So parasympathetic is going to be the opposite. We're going to have facilitative digestive glands, constriction of pupils. We actually don't need to let so much light in. The opposite, sympathetic, flight or fight, all of a sudden your pupils are going to get huge because you're going to maximize the light into your eyes so you can see better. And so you can just see they're opposite of each other. Defecation, that's just sort of part of our GI function. We need sexual arousal, actually parasympathetic. The sympathetic nervous system, so we're going to break these up into two parts. So just to get ahead of ourselves, like I normally do, remember it's a two-part system. If we have our spinal cord, and this is our cell body dendrite, we have this axon and it's going to release acetylcholine, right? Then we have our second one and it's going to go out onto the tissue. We'll just use the heart as being the tissue it's going to, and it's going to release norepinephrine. We'll just keep that in mind. Later, we're going to learn the receptors. How it works between the two is the sympathetic that we're talking about now. You're going to have our cell bodies and dendrites. The axons go here. The little Y represents the axon terminal that's going to release acetylcholine. Then we have another one, cell body dendrites, and then it's going to go here, release norepinephrine onto the heart. That's our two-part pathway. But the sympathetic nervous system has this funky chain network that we're going to talk about, because we can actually do this. We can have our cell bodies dendrites here. It can actually go up here and terminate there and meet this nerve. So we have actually ways for our axons to travel up and down the chain, and I'll tell you why later. But this here is known as the chain ganglia. That shouldn't be too hard to remember because it's actually linked like a chain, and that's unique to the sympathetic nervous system. The parasympathetic, still the two-step pathway here, still has two steps. We have 1 and 2, but it's just the normal ganglia. The ganglia aren't connected together. And then the bottom going to a skeletal muscle is just for reference because that's what we did in Unit 2. So for the sympathetic nervous system, this is just a picture from one of the textbooks, but the point I want you to know is they only come off the middle nerves, segments T1 through L2. The sympathetic ones, and then we have the chain ganglia, which I'll show a picture in a moment. This is opposite to parasympathetic, is actually coming from some cranial nerves or sacral. So our two parts of our autonomic nervous system don't even come off of the spinal cord at the same place. So I want you to know that the sympathetic nervous system, I think I have another slide where it summarizes this, but mainly it's known as thoracolumbar, which means thoracolumbar says it's coming from thoracic and lumbar spinal nerves. They tend to have really short part 1, which is the preganglionic, and then a much longer part 2. This is the opposite of what this the other will be. So this is my representation of our chain ganglia. We have our step 1, which is our preganglionic neurons in the purple, and the green is going to be our step 2, which is our postganglionic neurons. You have it as thoracolumbar. That is probably one of your test questions where it's thoracolumbar. I might like a test question, something like that might say, thoracolumbar refers to which part of our nervous system? Sympathetic, parasympathetic, somatic, and then I got to make some other stuff up. And then you'd think, oh, thoracic and lumbar, that would be sympathetic. So definitely connect that term, these two terms with each other. Then the chain ganglia. So you don't have to know all these numbers there. I just want you, they're pointing out that they are there. So what I want you to get from that without memorizing how many's in each one is this chain ganglia actually extends up. So even though, say it's coming off of T1, so say this is T1 and it does it, all 12 of the thoracics plus the 2 lumbars, there's 14 of them that come off. The chain ganglia, we have more chain ganglia beyond that than where the spinal nerves are coming off the spinal cord. So even though we only have nerves coming off of the thoracic and lumbar, we still can have sympathetic activity going to, say, our cervical region. Say if you're really nervous, there's fight or fight's kicking in, and maybe you get beads of sweat on your forehead. Well, that is part of your sympathetic nervous system that's actually activating sweat glands in your forehead. So that's coming up through this portion up here, even though the spinal nerve can't be higher than T1. So that's how the chain ganglia lets that axon go all the way up really high to synapse onto part 2 that's going to say go to the sweat glands of your forehead. So the point of the chain ganglia is it gives a lot more distribution or a wider range for the sympathetic nervous system over the whole body. This is what it looks like. This here is the chain ganglia. They're on either side. Let's see. So you can see, even though we're coming off the thoracic portion here, there are chain ganglia that bring you all the way up to be able to control the eye or the salivary glands because you have dry mouth, or even up to the heart and raise your heart rate. So this is all sympathetic action. Or likewise, even though you only end in L2, we actually have some nerves coming off really low that would be more sacral that might go to our reproductive organs and our bladder and so on. So again, the whole point of the chain ganglia is it gives a wider range throughout the body and not just only what's coming off of the thoracic. So it gives kind of more of a highway, so to speak. The 3 important things to know. So we already have 1 is our first step. Over here is our second step. The first neurons are going to be short. These second step ones are going to be long because these chain ganglia are pretty close to the spinal cord. So that's one point. The other point is these weird guys. We have a second set of ganglia that are very specific to just the abdominal cavity because there's so much going on in the abdominal cavity that we don't have conscious control of, like our guts and our liver and our urinary tract and our reproductive systems, that we actually have these what's known as paravertebral ganglia. And so these guys here are additional clusters. Think of them more like as routing station to go to the right place. Our sympathetic nervous system is thoracolumbar. We have the celiac ganglia that's going to the top part of our abdominal cavity. We have a superior mesenteric ganglia that's going to more your small intestines. And then think of your inferior mesenteric ganglia going to more your bladder, reproductive organs, just the lower part. So again, you have upper part of the abdominal cavity, sort of middle part of your abdominal cavity, and the lower. Those are the 3. And just, again, it's directing autonomic impulses to those parts of our body. Not only do we have chain ganglia, we have these other collateral type ganglia. I called them paravertebral, sorry. They are collateral ganglia. Paravertebral is another name for chain ganglia. The final weird thing about the sympathetic nervous system is the adrenal gland. The adrenal gland, I want you to notice, is, say we have a cell body dendrite. We come off the spinal cord. We go through all the way to the adrenal gland. And that is still step 1. We haven't synapsed onto a second one. So from the adrenal gland, because it's a gland, when a gland releases a chemical into the blood, so we'll say chemical, to the blood, it's actually called, I'm going to say to blood, it's actually known as a hormone. And so now the hormone circulates through the blood and actually can go to all of these organs, right? Because it's coming from the blood rather than from a nerve. The specific chemical that the adrenal gland releases is also norepinephrine. Epinephrine. Also epinephrine. We commonly know those as adrenaline or noradrenaline, but it's properly known as epinephrine or norepinephrine. The adrenal gland, and so we'll shorten norepinephrine to NE. So if you recall, we might start a normal one here, preganglionic neuron, synapses onto here. Then we have the number 2 postganglionic neuron moving out here, going to the heart, and it's going to release norepinephrine to the heart. That's an N and an E, and look where it ends. In this scenario here, that would be like if you're watching a scary movie and you're getting all sympathetic nervous system and someone sneaks up behind you and taps you on the shoulder and it scares the pants off of you. So that immediate being really scared and jumping up, and immediately your heart rate, jumps up, immediately your gut clenches, you're frightened, your pupils dilate. That immediate reaction is so quick that it actually came from this nervous system, this, two-step pathway, 1 and 2. However, at the same time you jumped up and your heart rate increased, you also dumped out a bunch of norepinephrine and epinephrine from the adrenal gland. Well, so then that's coming through the blood. I'm going to put norepinephrine here as one. It's also epinephrine. And that's also going to go to the heart. So in that case, when you get really, really scared, your initial reaction is, oh, I'm scared and my pupils dilate. That's the nervous system, the two-part pathway. But then when you look around and you're like, oh my gosh, that was just my little brother snuck up behind me, and my little brother, I'm safe. That really isn't like Freddy Krueger or whatever scary person. It is the norepinephrine that got released by the adrenal glands in the blood that just stays around longer. So when you know that you're safe, like, hey, it was just my little brother trying to scare me, so I'm actually safe, I'm really not in physical harm. But for like 20 minutes after that, your heart is still like beating for a long time. It's taken you a while to kind of come down from that fright. That is because of the norepinephrine that the adrenal gland dumped into the blood, and it's circulating through your body. In a real situation where you might have to run away from danger, this blood-borne norepinephrine helps you sustain the activity so that you can maintain it rather than nerve impulse after nerve impulse. So here we go. Here we have the preganglionic neuron. Initially, will come to the chain ganglia. It will synapse onto a postganglionic neuron, and this will cause the heart to increase in heart rate. We can also go to a preganglionic neuron, and it can go up the chain and go over. You can also have a preganglionic neuron blow through the chain ganglia and make it to that secondary ganglia that in the abdominal cavity. And then from there, you'd have the secondary neuron go to whatever organ. And thirdly, the preganglionic neuron in blue was going to go to the adrenal gland, but instead of having the part 2 being the red lines, which is the second nerve going to the tissues, part 2 is really the blood. It's that hormone or that actual neurotransmitter in the blood, so it's by definition now a hormone. And that's going to go, that'd be the part 2. So these are the 3 ways that the sympathetic nervous system goes. You can go to the chain ganglia, you either go up it, down it, whatever, you just get the chain ganglia, so when you leave, you're at number 2. You go in as number 1. Or if you're going to the abdominal pelvic cavity, you're going all the way to these collateral ganglia. And number 1 goes there, and number 2 then goes out. Or the third option is your number 1 neuron coming from the central nervous system goes to the adrenal gland, and you really don't have another number 2 neuron. Number 2 is just the chemical being dumped in the blood. So this is just a thing of the ganglia. I don't care that you know the names specifically. I may mention the names, but if you just think of celiac as the top, then this is the middle and this is the bottom. So we have top, middle, bottom of our abdominal cavity. So if you think of, obviously the bottom, think of that's where your sex organs are, the bladder. Those would be examples that I would use for this bottom ganglia. That would be the inferior. And just think of the top as celiac. Well, what's way at the top? The stomach's at the top and the liver's at the top. So those would be examples that I would use for that. It's less about knowing their names and just knowing they disperse through these areas of the abdominal cavity. The adrenal medulla, that was the third one I talked about. It's going to release hormones. The hormones are norepinephrine and epinephrine, and those are the same as the neurotransmitter. They're just arriving to the tissue through the blood, so it can actually maintain performance without overtaxing your nerves. Now, the parasympathetic nervous system is way easier, so I make you do the hard part first. So the sympathetic is pretty complicated. Parasympathetic, still a 2-step pathway, but that's pretty much it. It's pretty basic. So the parasympathetic looks like this. What I want you to notice is you either have cranial nerves So there's a very number of cranial nerves, or you have sacral nerves. So remember, the thoracolumbar was the sympathetic, but parasympathetic is known as craniosacral. So the nerves that provide us with our parasympathetic activity come from either up high in the cranial nerve or way down low the sacral nerves. So there are 4 specific cranial nerves, and this is what they're doing. They're going to deal with pupil constriction, salivary glands, vagus nerve. I have this one because that is the vast majority of all of our parasympathetic. If you remember, vagus nerve is cranial nerve number 10, and that's known as the wanderer, and that actually comes down and it controls all of your organs. And so that's why it's the most of it is there. We have the sacral nerves. Obviously, that's going to be located way down. Defecation, urination. So it goes to your reproductive as well as your urinary systems. All right. So the parasympathetic division is we have long preganglionic fibers and short postganglionic fibers. So it's the opposite. You should know which cranial nerves are part of the parasympathetic nervous system. So here's a picture showing you the cranial nerves as well as the sacral nerves down there. You have a cell body dendrite here. You go out, you release acetylcholine onto your second number 2, and it goes out to the organ and you release acetylcholine again. That's it. Pretty straightforward. All this mess here, don't worry about it, is just the vagus nerve going to all the places of our body. So that's the vagus cranial nerve number 10. The breakdown here of the specific cranial nerves. The vagus nerve is the vast majority of them. So everything is like decreased heart rate, slow breathing. This is us hanging out like a couch potato, or digestive functions, all of that. That's what's going on. This is our mellow side of our autonomic nervous system. So you would have a preganglionic neuron going to this ganglia out there connecting it. And then you'd have the postganglionic neuron. Here we have this preganglionic neuron and a postganglionic neuron. So the point here is I want you to know the green guys, which are the number 2, they are very short, except for up here by the eye, because of pretty much everywhere here, they're going to be just like that. Literally, the preganglionic neuron comes all the way to the organ itself. And so the postganglionic neuron is super tiny. It's there. It's a second neuron that you get activated because we still have a 2-step pathway, but it's super short and it's super tiny. Here we are back to the ganglia differences. Our number 1, which is our preganglionic neuron, is going to be short in the sympathetic and long in the parasympathetic. Our number 2, postganglionic neuron, is long in the sympathetic and really short in the parasympathetic. Also, we have chain ganglia in the sympathetic. We also would have extracollateral ganglia in the sympathetic, or we have the adrenal gland. That's sort of this funky little adrenal gland that's going to send out norepinephrine in the blood. So we have the sympathetic is a lot more complex. Now we'll talk about the specific neurotransmitters. We've been talking about some of them. We're just going to add receptors. Now we can label this. We have the parasympathetic is at the top. It's going to then release acetylcholine at its ganglia. And then what's this postganglionic neuron, which is going to be really, really short, is actually going to release acetylcholine again. So when the tissue gets acetylcholine, the tissue will respond in a parasympathetic way, slowing down heart rate or increasing digestion. In contrast, the sympathetic, well, it's going to have the same. It starts with acetylcholine, so they both release acetylcholine here at their ganglia. So the first step is exactly the same for both of them. It's the second step for the sympathetic that it's going to release norepinephrine. So obviously, if you're at the gland, so if this is a gland or smooth muscle or the heart, then if the heart sees norepinephrine, it's going to increase your heart rate. If the heart sees acetylcholine, it's going to decrease the heart rate. The somatic nervous system, it just releases acetylcholine. So this summary slide I want you to see is that anything that's coming from the spinal cord, it will always just release acetylcholine. The only difference we can see is if parasympathetic on the tissue is acetylcholine again, or sympathetic changes it up to be norepinephrine. Acetylcholine, because of the choline, they're known as cholinergic. So when you guys get into the nursing program, you're going to hear in the pharmacology portion about cholinergic drugs. Cholinergic pharmaceuticals will actually target things that use acetylcholine. Now we have two different receptors. Both of these receptors, a nicotinic and a muscarinic, respond to acetylcholine. So it can be pretty specific. So you can actually block one or the other. So if acetylcholine is a neurotransmitter being released, then the receptor on the other side could be either a nicotinic in one location or muscarinic in another location. So pretty much anything here, that's going to be nicotinic receptor. There's a nicotinic receptor and there's a nicotinic receptor. Obviously they're acetylcholine, but it's the nicotinic subtype. So the dendrites here for this number 2 has a nicotinic, and it has a nicotinic receptor on that one, and there's a nicotinic receptor there. The other receptor that we have for acetylcholine is muscarinic, and the only place for it is at the end of the road for the parasympathetic nervous system. If you gave somebody a muscarinic blocker, they would not be able to operate their parasympathetic nervous system. But you could still work the sympathetic and you could still work your muscles, but if you are only blocking muscarinic, you're not allowing the craniosacral part actually to do their job at the tissues. The other neurotransmitter is the norepinephrine, only sympathetic, and those receptors could be either alpha or beta. It could also be epinephrine too. I just keep using norepinephrine as an example, but epinephrine as well. You probably have heard of medications or pharmaceutical medications that would be known as beta blockers. A lot of people with high blood pressure are on various forms of beta blockers. It's actually trying to make sure your heart rate doesn't increase, so it's going to block the sympathetic effect. So norepinephrine would be released and it will bind to an alpha or beta receptor. This is the best summary slide that you can have. Not only did we have, our number 1 and our number 2, and we knew that all the number 1s released acetylcholine, but now you have the receptor here added to it. So it will be a nicotinic for both parasympathetic and sympathetic. So step 1 is going to be identical, nicotinic. The difference, again, we know acetylcholine for parasympathetic or norepinephrine for sympathetic, but the receptor that will bind to is a muscarinic, which is different than the nicotinic. So you can see the 2 types for acetylcholine, or if it's norepinephrine, it's going to bind to either an alpha or a beta. This is pretty much the single summary slide of the 2-step pathway, which neurotransmitters are involved, as well as their corresponding receptors. That's pretty much the same thing. Norepinephrine, you can go to alpha or beta. So we have norepinephrine as a neurotransmitter, but remember norepinephrine and epinephrine can come via the blood from the adrenal gland, and that will also bind to alpha and beta. So wherever norepinephrine comes from, whether it's from a neuron or dumped out into the blood, it still binds to alpha and beta receptors. There are, you don't have a test question here, but I want you to know there are subgroups. There's alpha 1, beta 1, and so on. There's many more than beta 1, beta 2. But there's even further subgroups. So if somebody's working in the pharmaceutical industry and trying to make new drugs, we actually have maps within our body, and a lot of the research is finding new places where, say, someplace in the lungs, you might have a beta receptor. We know, okay, there's beta receptors in the lungs, but certain parts of the lungs may have beta 2, whereas a different part of the lung might have beta 1. And a specific, if you want someone to say dilate for asthma, or say have an increase in depth of breath, there are going to be different receptors. So this is a way to better target and specialize medications for specific patient needs. Dual innervation just means that a lot of our organs are going to have both sympathetic and parasympathetic. However, parasympathetic. It's never going to be 50-50. Parasympathetic is going to dominate. We will always have more parasympathetic activity than we do sympathetic. So it's not even. Just because they're both innervated, you have more parasympathetic influence. Autonomic reflexes. So we talked about skeletal muscle reflexes. You whack someone on the patellar ligament and their leg flings out. That's a reflex. Well, we can do autonomic reflexes, and it could be as simple as you smell cookies, yum, smell good food, and now you're going to salivate. There you go. So some of these are basic autonomic things. It just is also a way to get these to work. But for the autonomic nervous system, you will need to know the two-step pathway. You'll need to know the parasympathetic is craniosacral. You should know the 4 cranial nerves of the parasympathetic. You should know that even though you only have 4 nerves coming off the cranial nerves, and you have sacral nerves, you can still, those nerves can still make their way to the guts that's in between them. So it's quite far reaching, especially if you're using the vagus nerve. So I just know that the whole body is still under the influence of either sympathetic or parasympathetic, even though they're real limited on how they come off the spinal cord. The sympathetic is thoracolumbar, parasympathetic is craniosacral. The sympathetic goes through a chain ganglia. Sometimes it will go on to a collateral ganglia in the guts, and then it'll disperse from there. And the sympathetic has the unique feature of going straight to a gland, naming the adrenal gland, and so that it can release the same chemical as its neurotransmitter, but into the blood as a hormone to sustain the performance of flight or fight for a longer duration. You should know that the preganglionic neuron for both sympathetic and parasympathetic will release acetylcholine, and it will bind to a nicotinic receptor on the postganglionic neuron. Then that postganglionic neuron is going to make it to the tissue, and if it releases acetylcholine, if it's parasympathetic, it will bind to a muscarinic receptor. If it releases norepinephrine in the sympathetic nervous system, it will bind to either or both an alpha and beta receptor. The alpha and betas are distributed throughout the body differently, but we're not going to go over that. I'll leave that for a future pharmacology course. But I want you to know, so what I want you to leave my course knowing is the basic elements is that if you have an alpha and beta receptor being stimulated, you know that's part of your sympathetic nervous system. That's flight or fight. If you're going to block an alpha or beta, you're trying to lower your heart rate because you're trying to block that extra effect of the sympathetic. What you should know from the autonomic, again, is the two-step pathway, the differences between parasympathetic and sympathetic, the neurotransmitters and the receptors, as well as the thoracolumbar, ganglia, that other page there. So this, if you have parasympathetic nervous system, it's going to tell you craniosacral, and you'd probably just want to add which cranial nerves do these things. That would be the only other thing I would add to this. Sympathetic nervous system here, you've got it here. It's thoracolumbar, you have chain ganglia. I don't have the collateral ganglia on here. So you probably want something more along the lines of here. So you can have chain ganglia and collateral ganglia as well as the adrenal gland.